start? It says it's going.
Okay.
Yours say,
Please ask the host to give you permission to record.
did you ask?
Can you give me permission to record?
I don't know how to do that.
I think you have to go in your settings
Escape.
and then allow recording. Unless you want to send, you can just send me a copy of the digital recording file, and you can just email the link over to me, and then I can send it that way.
I could do that. I don't know how to give you permission to record. What if it does? What if mine doesn't record and then we do all this?
Video settings.
Is
There, look at, I low light adjusted.
Look at you,
So
meeting.
I'm so good at this.
Call to unmute, invite, pause recording, stop recording.
Hide non-video, see myself. Accessibility, maybe.
Services.
Recording
Settings.
permission granted.
Did I give you permission?
It's checked.
Did it go?
Go into your video settings.
Okay, is that up top?
Where it says start and stop video at the bottom left, there should be like an up arrow.
Okay, there we go. Video settings.
Yeah, go to video settings.
Okay.
And then down on the left, there's accessibility.
Okay.
And I think under there I saw, if you scroll down to the bottom.
All of my things are checked.
Oh, no, in the middle. Yeah, mine are too.
Huh.
Okay,
recording.
Oh, wait, recording. Here's a recording.
Timestamp to
record video during.
I'll choose a location to record to after this meeting. I don't know.
Okay, so maybe you could just send me, if you could send me a copy of the file, and then, yeah, you should be able to send it to whoever you want so I can record it that way.
Let's just hope I can find it after this.
Yeah, do you want me to ask my 11-year-old? I think she knows.
It says it's recording, so we should be good.
Okay. All right, so for our book group, I just wrote the list of questions and some notes that I took down. So if we want to go question by question.
Perfect.
Okay, you can lead us if you want.
Okay, so question 1. Part 1 of the book was titled Bad Teeth. As a dental hygienist, how does this term resonate with you? After reading the first 4 chapters, has this opinion of the term changed? I think that the term bad teeth is really like perspective. You know, we have patients come in all the time that like have just this tiny little chip and they're like, oh my gosh, my teeth are just bad. Like they're just, and then there's people that come in and their teeth are bombed out and they're like, I just have bad teeth. So I don't know, like, cause the beauty queen in chapter 1, I think that was chapter 1.
Chapter 1, yeah.
Yeah, she had thought that her teeth were fine. No, she at the end of the chapter had been like, I kind of liked my teeth, you know, but the office that she went to wanted to spend like thousands and thousands of dollars, you know, making her teeth better.
Right.
No.
Which wasn't her perception of better.
No. And she liked her teeth. But then like you think about all the people that waited in line at the health clinic, you know, to receive their services over day and overnight. And they, you know, had bigger problems like infection and like actual issues.
Right.
I don't know.
Right. I thought bad teeth, well, I mean, we hear it, right, in the chair. Oh, it's just my bad teeth. My mom had bad teeth. My parents had bad teeth, so I have bad teeth. Like it's something that we just inherently pass down. And aside from having like actual a disorder or a deformity or actually something physically wrong with the tooth, I think I used to think that it was like an excuse for people to just not care for their dental needs, or they say, oh, it's just inherent in the family, so like I can't possibly do anything about it. Like maybe some people get to that point in their mind where they just disregard the choices that they could make to not have those problems, you know, or find solutions to those problems. And has our opinion changed? I would say yes. Over the years, I have more compassion, I think, than I did when I was just very black and white about things. You you don't have bad teeth, you just don't care for your teeth.
Yeah,
And then we place the blame on the patient when in actuality it's now our burden, it's now our job to help them manage
their teeth.
their perception of having bad teeth and kind of like redirect them. There's things we can do because it's almost like when you say I have bad teeth, you're just at a hopeless point,
Yeah,
instead of having a positive outlook, there's things I can do to change this situation.
yeah. Or what can I do? But I also think that, like our reading of, people choosing their own health, like that kind of plays a role into people having bad teeth. Like some people could make better choices, some people don't
Yeah.
have the ability to make better choices. So I don't even know if it's this book that has necessarily changed my full opinion. The book in combination with a lot of other things we've learned over the course, because the book just kind of takes it and puts into like real life perspective. You know what I mean?
Yeah, that nature versus nurture
Yes.
perspective and looking at the circumstances surrounding
Yeah.
their position.
Yeah.
Yeah.
For sure. Okay. Should we move on to question 2?
Sure.
Okay. Are the RAM dental event and the mobile dental clinic described in chapter 2 public health programs? Why or why not?
So I put the RAM programs they were a free clinic
Yeah.
that was kind of like a pop-in, like a
Yeah.
pop-up shop kind of thing, which could be viewed as public health by some, but I don't think it was because it wasn't designated to meet the ongoing needs of the community. It was designated to meet an urgent need.
Urgent
And
needs
I think there's two distinct differences there.
is there. I kind of thought that it could be like maybe it wasn't like like a I don't know, but I thought it kind of could have been a public health thing because
Mhm.
you think of public health as just helping others with a need. I get that it's supposed to be persistent like that, but these people had the need and had no other services. So definitely wasn't ongoing. That's a good point. But I don't know. I thought that it was public health, it was serving the public to improve their health. I don't know.
Yeah. Yeah, that's why I think it could be you make a good point that it is public health is the broader view of public health
Right.
serving the community.
Right.
I would say it is.
Right.
But more specifically, I think public health is the ongoing, that
Right.
long term, what are we doing to change the community day in and day out?
And in their future. And yeah, that's a good
This
point.
specific RAM program, and maybe I'm confusing this with the ongoing need, but because they only came to one community,
Yeah.
but they really are an ongoing program that serves various
Different areas.
counties and different areas. So they could be considered
It could be, but you're right
public
that,
health.
they set up to help people with their specific dental need that one day, they came in pain or they had that one thing, but then they leave and they didn't get to help that person with a different area of their mouth that
Yeah.
hurt or their preventative care or, yeah. So that's kind of a
So like
complicated,
specific ties to
yeah,
each community.
right.
Yeah.
I don't know. And I didn't understand, and maybe they do that type of thing a couple times a year or started, or I don't know,
They said in the book it had been the first time that they went
to that
to
area.
the
Oh,
hills, yeah, to the hills, so it was their first time, going there. So they find the places with the most need, and then they serve the neediest of the communities
yeah.
with the
Yeah, that's a tough question.
yeah, maybe we'll get some clarification on it in our notes after this.
We need Jessica in the group. Where's Jessica?
Third opinion?
uh, okay.
Okay, number 3.
How
Go
do the
ahead.
social and behavioral factors you read about in your textbook apply to the disease stats that are described by the author?
You can go ahead.
So, um, I just talked about a little bit how we talked about in our textbook about lack of access to care, and that second chapter with the health clinics, not all these people didn't have access to care through their clinic. And, so they had that 1-day pop-up clinic, but
Right.
we talked, about people not being able to choose their own, health choices because they didn't have access to care or reliable transportation or all those good things. I mean, you talked that chapter about access to care, number 2, talked about how some people had spent all their money on gas to get to the location to have the tooth pulled, so
Right.
they didn't have that transportation. So I just thought that the access to care really related there. And then also we talked that 4th chapter in here that kind of talked about the relation between medical and dental startup. We also got some of those stats in the beginning of the book when we started reading it, kind of gave us an intro in the beginning of dental and founders and the process of, its evolutionary process a little bit.
Yeah. There were cultural considerations um, with as far as like health beliefs and diet, and then activities within a specific culture may contribute to like eating more sugar or um, you're gathered around and your family has like big feasts, so you're eating more at one sitting than any of these variety of things that you could face just because of the cultural aspects of something.
Yeah.
And then I have the socioeconomic considerations, lack of access to care, like you talked about, lack of money, no transportation, possibly unemployment. And then the statistics that we've seen in both our public health book and in Teeth both spoke to that. The correlation between a low socioeconomic status and a high incidence of caries or a high prevalence of disease,
Yeah.
whether systemic or in the mouth. So I think both the cultural and the socioeconomic factors play a role in our personal behavior and our decision making skills.
And that really also connects to, you talked about a little bit the lack of finances. That totally connects to the chapter emergencies where the young gentleman died because he filled the pain prescription, but not the antibiotic prescription. So
You remember that being on the news at all?
no, I don't.
It was huge news. Because I've been a hygienist for over 4 years now, but I've been in the dental field a long time, and I remember that being very big news.
Okay.
And my mom has been in the field a long time. I have a lot of family, so I hear these things, and it used to be a small dental community in Sacramento. It's grown a lot, but everybody talks about something like when something like this happens, and
Yeah.
it really sparked this connection for healthcare to
Okay.
be like, oh my gosh, maybe they're onto something that there's a
Dental's needed.
yeah,
Yeah.
yeah. We have the heart disease and the stroke factor, and we've been on that train for a long time promoting that. And now we're finally at the point where, and this kind of goes into the next couple questions, but where we're at the point where they're asking you before you have surgery the last time you've had your teeth cleaned.
Yeah,
So we've
which
made
is
good
really
strides.
cool. Yeah. And I've had patients come in that, have been patients at the clinic for forever and are having some sort of big surgery, like their knee replaced, or something like that. And they'll come into their next cleaning and they'll be like, yeah, my surgeon mentioned that I should have this done beforehand. And then that like opens the communication because most of the time their doctor doesn't tell them, but that opens the communication to be like, well, yeah, like you can talk about pathogens and all sorts of good stuff.
Yeah.
Hello.
Hi, Jessica.
Hi. Aren't we supposed to start at 6:30 today?
At 6.
6.
6. Okay.
We emailed you. We waited until about like 6:15 to get started because I was like, I know she saw the message. She checked
Huh.
her calendar.
Yeah, I even looked at the calendar again. It said 6:30. I'm so sorry.
Yeah, so we're recording. We're in the middle of question 3.
Okay.
So do you guys just want to continue down with that, and then we can circle back,
Circle back. Okay.
and then Jessica, you can give us your number 1 and number 2 question thoughts. That's how you guys want to do it.
Okay.
Okay.
So
Do you want me,
give us?
do you want
Yeah,
me to talk number 4? Okay.
yeah, please.
Has the lack of emergency room dental care impacted other areas of health in America? Well, we just kind of talked about that with the chapter number 3, his emergencies. And, he went to the emergency for his toothache, but then, left and filled the prescription for pain meds, but wasn't able to fill the prescription for antibiotics. And just kind of crazy. You know, people aren't able, they mentioned in the book, to get jobs without having, you know, a good smile. I feel like the lack of dental care definitely impacts the health, you know, of America. With some of
Yeah, we talked about Kyle Willis and
Mhm.
how lack of care can lead to death,
Yes.
if ignored. That's one of, the extreme cases. They
Mhm.
don't have many other places to go, so they'll end up back in the ER for the same problem that's not being treated, that's not being addressed. That money still has to flow through the healthcare system to get them
Yep.
pain medication or prescription or the time of the doctor. So there is a financial aspect to that,
Where they're
that I think healthcare is recognizing. And
mhm.
then disease in the mouth leads to disease in the gut that leads to inflammation, cancer, heart disease, diabetes. We have all these connections
Overall
now
health.
that we're looking at. So I think really the point is that what we see early on in the mouth from a poor diet or from untreated decay can manifest into long-term systemic disease.
Yep.
And so when we don't address that, we're seeing those effects in our healthcare system now.
Which is hugely underaddressed, you know, by medical providers and stuff like that, which I think it also talked about a little bit in, you know, the last chapter of the book where it talked about the connection between medical and dental. It's, you know, they're working on getting it, but it's still not. It talks about how dental is just,
Ugh.
yes, yes, slowly trying to ride the bike because it's just not there yet, the connection. So, which is hard because, you know, people see, I think people go in and see their doctor more frequently sometimes than their dentist, especially in this, like, I work in a pretty low, you know, income area. And so a lot of people, you know, go to our medical clinic and have never been to the dentist, you know. So that's a good chance for them to be like, and we have a dental department, you know, and it plays a huge role into your overall health. But, and I'm not gonna lie, they do not do a good enough job at that. So there's still a disconnect.
What about you, Jessica?
Yeah, so to kind of go off what you guys were talking about, there was an incident where a guy, he didn't have the finances to pay for an antibiotic because it was overly expensive versus for pain medication. So he had the money, which is a lot cheaper, to pay for pain medication versus, you know, paying for an antibiotic. And so because he didn't have that antibiotic, that resulted to his death. I think that people are still considering dentistry as considered more of a trade versus a healing art. And I think that's just where it's coming into play where unfortunately, you know, I think pharmaceutical companies are also at fault at this, at least make the antibiotics cheaper than, you know, the pain medication and vice versa. And so I think it's just educating the patients how essential, you know, caring for your mouth, even if you're experiencing pain, you know, getting that root canal done, even though if it's not causing any pain right now after antibiotic, you should still get it treated because it is infection in the mouth. And so kind of correlating how your mouth is just, it contributes to your overall health.
What a hard choice to make, right? Like if you
Yeah.
had $8 in your pocket and you had to choose between getting an antibiotic or relieving the excruciating pain, which is what drove you into the hospital in the first place, you
Yeah.
know?
And a lot of people don't understand that if you took that antibiotic, you know, for long enough, it would also help with the pain, but, you know, it's not the quick fix.
Yeah.
Right.
Yeah.
Yeah, that's the ongoing
Yep.
rough spot.
Okay. Are we ready to jump on to number 5?
What else did I have? Oh, I thought that this the way you were talking about the healthcare system that how we just give them the antibiotic, the pain medication, go see a dentist, go take care of it over there. We in the healthcare system don't deal with that. You
Yeah.
know, it kind of sends off it sends off the message that it tells Americans public that dental health isn't as important as
Yeah.
your body health or your overall health. Like it's perpetuating the thought of it's separate.
Yeah.
Oh, we don't do that. We don't do that. We don't deal with it here.
Mm.
Yeah.
Yeah. There
Which,
definitely isn't enough, you know, care in the emergency setting for dental, for sure.
yeah, or training.
No, definitely not. Which is kind of funny because you'd think that, I don't know, I just feel like you'd think that it would be a bigger priority than it is for certain medical providers.
Yeah.
Yeah.
I think that's a great lead into number 5.
Hmm.
Okay, so number 5, at the end of this section of the book, the author outlines the history of the profession of dentists in America. How have the attitudes and professional focus of the profession changed since its start in the early 1800s? Has this impacted the health of the America? So let's see here.
We used to chloroform you.
Right.
We've made vast
It's
improvements.
a joke around our office.
Yeah.
Yeah, it was actually kind of interesting to read that last chapter, even though it was kind of broken up and long, the different little sections. Sometimes I had to put it down and be like, okay, I'll come back to you later.
Yeah, we were saying before we started the video that like we both agreed the last chapter was a bit choppy. So it was kind of hard to keep up with the constant change of history. Wait, like what person are we talking about now?
Yeah.
Yeah, it was a little difficult, but it was a like almost like a timeline
Yeah.
moving through.
Yeah, I'm kind of interested to find out that the physicians were the ones who were instigated being fascinated by oral bacteria was not universally embraced by the fellow dentists. So they studied the oral disease, but the dentists were the one who, what's it called, were how did I say it? They were not really, they were opposed to it and they just wanted to stick with, extractions and, placing fillings and root canals, but they didn't really, connect to the oral bacteria. It's just the physician that started it. And so they started to defy physicians and physicians started to defy dentists. And so there's that mistrust between the two groups. And I think that mistrust has been carried on for years.
Yeah.
I think that's why we have this huge gap between the two fields. And we still don't really, we're starting to now realize the importance of both fields and starting to now, close the bridge, but it took years of just mistrust and, combating one another, just of these interests and so on and so forth.
Yeah. Do you think that perpetuates when, especially because in dental, like when we talk about, we know the antibiotic, pre-medication guidelines, we get those updates too. And to be telling patients, okay, well, in 2015, they changed these pre-medication guidelines, but, talk to your primary care physician, talk to your, of course, talk to your surgeon, but, we're always kind of, oh, go talk to them. Like,
Yeah.
like we don't know what we're talking about too. We do. We should be working in tandem and speaking to each other because the patient really doesn't have 100% of the information all of the time.
For sure.
Yeah.
They're so freaked out because they know that their surgeon, at one point in time told them, you're going to take this for life, so now they're like, well, he told me, 20 years ago that I was going to take this for forever. So there's no, they don't know. And if their surgeon's going to tell them that, who are we to be like, well, actually,
Yeah. I was surprised at the divide because we all know it exists. And in dentistry, we've been fighting, this uphill battle to be recognized as a healthcare profession and not just doing like cosmetic procedures and whitening teeth and, it's healthcare. We've been fighting this uphill battle to be recognized. I put the scientific discovery developed, like they talked about in the book. Dentistry turned into more of a specialty or a trade than it was like a medical necessity to have this healthcare, like the medical field moved on, and it created that divide. We separated from traditional medicine, which separated the mouth with the rest of the body in terms of how we take care of ourselves. And then the negative impact on society occurs because now they see the separation. We treat them separately. We even have separate insurances that deal with separate parts of our body when it is healthcare as a whole that we want. So, but I think we're more aware of the systemic links today, and we've made a lot of progress, and especially in the last 5 years, of recognizing heart health that may start in the mouth, or recognizing that the bacteria in the mouth can cause a secondary infection, complications, things like that, all these links that we're making. And even with the new studies now for, I don't know if you guys have read those with the mice, and they put the P. gingivalis, all the bad bacteria, injected into the mouths of the mice. And then they dissected them and found that same bacteria in the synapses of the brain, which they can contribute to cognitive decline, which is huge that we can say we found a connection,
That is
you
huge.
know. So we've made a lot of strides, but I didn't know that it was like this. It started so long ago.
Yeah. I thought that was cool too. I took away, from that last chapter, it was fun to just kind of follow the process. They started with like the school opening in like the 1840s or something like that. And then they, talked about the infection process and figured out a little bit about bacteria and then caries. And then from there, they talked about, patients, they figured out if they changed their brushing habits or changed like home sanitization and city sanitization. And they figured out that you had to change hospital design to make that cleaner, to have surgeries go more successfully. So it's just kind of cool to, figure out the process of, okay, dentistry started, but brushing still wasn't really a thing. And then, a few years later, they're like, oh, well, this will help, and so it's cool to just kind of go between, down the line. And then they made the connection between, okay, your oral health is important to your overall health, and it's connected to medical, but still was kind of a gap there. I don't know. And it was interesting that even at the end of the book, they talked about how, or the end of the chapter, they talked about how there is still a huge gap in medical, which we see, but it's interesting that they'll put that in the book too.
Yeah.
Yeah.
I had a patient from oh my gosh, where is she from? I think she's from Puerto Rico, and they have one insurance. It's health and dental all in one. And so in my thing, she thought, dental health is, incorporated as overall health because it's all in one insurance. So I think maybe if insurance companies also play a part in that as well, like dividing it to what if we combine it all and people just logically like, oh, it's all one health instead of two separate sectors. I think that's another, mind trick or game that they play also, people that they separate the two fields.
That's
Right.
a lot to have. Yeah. Because it is, we preach that, but you're right. Insurance isn't the same.
Yeah.
All right. Do you want to circle back around and give us your thoughts on
Number 1 and 2.
number 1 and 2? I think we might.
Yeah, I can gonna go over what I wrote down. So for part 1, the book titled Bad Teeth. So I think, Bad Teeth is talking about the American perspective of good aesthetic looking teeth. We're taught that alignment provides better natural cleansing mechanisms by our saliva, along with the contour of every tooth and tongue. And so if there's poor alignments, it creates, attractions of plaque and tartar built up. And so I think we are really kind of drilled in us the prevention part. And I think to us, when we look at teeth as bad, we look at it as to prevent, periodontal disease and tooth decay. But in the sense, in the impression of teeth, teeth tell a story. And so as America markets extremely on white, having white teeth, veneers. And so, I mean, they said that the Europeans look at the aesthetics isn't as aggressive as here. They want the natural looking teeth, natural, tinting of yellow. Here we just want, what is it, B1?
Yeah, as wide as you can go. Yeah.
Yeah, exactly, B1. And so I think we put a huge emphasis on aesthetics department, and that's what a real money maker is, but it kind of hides, the culture of one person. And so I think when the girl was on stage for her pageant, and so she thought her teeth were fine until someone pointed out, hey, you can get your teeth fixed. And she's like, well, the reason why she kind of won, I think, is because she kind of embraced her culture. And so you shouldn't be ashamed of her culture. Like, for example, the African American culture, I don't know which one exactly it is. They have a gap between their teeth and they find that very beautiful. We have a football player. Oh gosh, he doesn't play football anymore, but he's one of those, is a spokesperson. I don't remember how to call it, but he has this huge gap between teeth. He has all the money in the world to fix it, but he represents his culture and it's beautiful to him. I think for us, I think it's just based on society and the culture that we live in America, is just, we define what's bad and good, but to different cultures, they don't think it's bad.
Yeah. Michael Strahan, I think, is who
Yeah,
you're
there you go. Yeah, I was like, I know his name, just like, oh my gosh, yes. And so I think
model too. There was a model within like the last few years that had like a really big gap, and I remember it was like the biggest thing. Yeah,
it's a French model, and I think we are just kind of stepping on toes and saying that we need to normalize everyone hey, this is what beauty is, but no, we should embrace our own looks and how we were made. And so I think now that's becoming more acceptable instead of, conjoining what the norm is of what, good teeth are. And even though, like they say, the dentists are psychologists, we tell patients that their teeth are bad and they'll believe it. And I believe that's true. So I think it's all in the hands of the provider. And even when a patient comes in my chair and like, oh my gosh, I have bad teeth. I'm like, no, you don't have bad teeth.
No.
Yeah.
Let me take care of you. Let me treat you. We still have a lot of life left in these teeth, So number 2 are the RAM dental event and mobile clinic described in chapter 2, public health programs, why and why not. I didn't think it was because in the second page of the book, it said the director said that the healthcare had been a chronic problem, not enough primary mental health care providers. These are not forgotten people. It's a system that has passed them up. So my, understanding what public health is, it involves federal agencies, primarily those within the U.S. Department of Health and Human Services. I believe that is part of the rural program that forgot these people, and that's where the system has, passed them up. And so RAM is a nonprofit organization that kind of stepped in and saw the needs of the people, and that's where he says he won their trust by providing to their needs. He said, "I can do dentistry, I just can't sell dentistry," and so I think that's what the whole part of RAM was, is to provide care that you know that was overlooked by other um, programs. So, yeah.
We went back and forth on that one,
Yeah.
kind of like, well, it could be, but it wasn't. My thoughts were that it wasn't a long-term, like settled in the community program. So when I think of public health, I think of grassroots. I think of like in the community, involved. You're there day in and day out. You're like a long-term. And then
I was kind of thought that it would be considered public health because I think the whole purpose of public health is, finding the people that have the need and providing that need. So I totally got where she's coming from with it's not, because it's not, they were there for a couple of days. They helped people with their health, but that kind of is what public health is, all about, is going to areas where people do need more health and providing services,
right.
to help them with their health, even though it's not like a public health organization or clinic or something like that, but they were providing health to the public. I don't know.
Yeah, both.
Yeah, it is both. Yeah. But when you think about the government, is it government intervention? Not really. I think
No.
it's a person that has a good heart and they saw the need and they just jumped in and providing care to the public.
Yeah, it took a lot though to put it together, and I kind of think that this whole class is about her trying to get us out of our comfort zone to see ways that, public health is around us and we don't think about it in the traditional, manner. I think that that's the whole point of the class. So I kind of think that this is her being like, these are other ways, guys, that public health can help out. So
Yeah.
I don't know. That was my opinion there.
Yeah.
She told me in our video chat, she's like, you guys get way too stuck in the, public health is this and public health is this. And she's like, the whole point is to think outside the box. So I'm reading this and I'm like, well, I don't know, but probably.
Yeah, gotcha.
Yeah. Is it like, because public health can be of so many variety, like variations of things. But when I think of public health administration, I think government. So
Right.
that's maybe where I'm getting caught up is the who's paying for this?
Right.
Yeah.
It's our tax money.
Yep.
Yeah. Yeah. All right. Well, that was a good discussion. I'm glad we got our first book group underway. I think we have 4 total.
Okay.
So do you want to be the one to like facilitate it and set it up each time, or
Sure. Let's hope this goes well and the recording is seamlessly when I end it. And I'll try sending it or posting it to the group.
So Jessica, we tried to get Mackenzie to give me permission to record, but she doesn't know how to change the settings. So I will ask my 11-year-old daughter how to do that next time. Or you
can set up the Zoom. I don't know.
Yeah, so she's gonna send us the link to the recording because we each have to submit it individually.
Okay.
So we'll do it that way.
I'll try to do that afterwards. I'll try to send it to your email. And we can just kind of go from there. If it works, great. We can do the same thing next time.
Okay.
Yeah.
Perfect.
Sound good?
All right. Thanks, ladies.
Nice to
Have a
meet
good
you.
Super Bowl weekend, whatever you guys are doing.
You too. Bye,
All right.
guys.
Bye. Thanks.
Fine.